This is Dr. Lewis Gilbert presenting a model of mental illness, is what I call it. And it's based on, the model is based on the Spindle model of color theory, basically the Oswalt color theory system more than any others, but once in a while the other color models may come in. What it is an attempt to arrange and systematize some psychiatric observations, and basically it's not necessarily a model that you can deduce things from, but maybe so, but mainly at least can serve as a mnemonic. So whatever convenience there is in it overrides for me any actual empirical validity that it has. The first page here is basically a summary of the assumptions that went into this and stuff, and what it is a three-dimensional spindle model, just like the color model that Oswalt and others have had. And so it's basically got, if you look down in the middle, you'll see a disc there that's colored. It's the color wheel. It's got 4 disorders. It's the schizophrenic spectrum disorder, the anxiety disorder spectrum, and mood disorder spectrum, and delusional disorder spectrum. And you'll have to read a lot of it because it's just too much to try to state, and it'd be too cumbersome. You'll just have to read it yourself. Anyway, what it does is it gives kind of a psychiatric syndromes in a nutshell, shows some relationships between them according to this model. First of all, we'll have to review the color spindle some, and here's the basic color spindle used to model, by analogy, some of the properties that seem to be reflected in this model, some psychiatric disorders. And of course, this is a model and therefore an analogy that I'm using. Here's pictures of these color spindles. And here's what I call the nuts, bolts, and parts of the color spindle. And so there's aspects of it that we'll look at here, and these will be used to sort of systematize these disorders. And here's just this Oswalt system. It's on the outer rim, the waist of this spindle is the different hues, and then it shows the saturation, the brightness, and the lightness. In other words, there's 3 dimensions here. This will become more apparent as we get going. Here's this color spindle that's a little bit more elaborate, and if you look over on the right-hand side, you can see that these colors I have matched up with, starting at the top, mood disorders, delusional disorders, and schizophrenic disorders, and anxious disorders. And so these ends where you see the small letters is presumed to be normal variant, just personality. And as we go toward the middle, the disorders are going to become more severe. It has an arousal level, which is the vertical axis. This will allow us, if you go to the left-hand side of the slide, you can see basically that this can be made into a spindle, and this gives it the character of that color spindle. Now, the vertical axis is what I call an arousal level axis, and positive symptoms, which are symptoms that are added on, generally more active symptoms, toward on the upper half, and it says seizure on top, and it's basically these disorders seem to all, you go toward the middle of the disc, seem to coalesce into groups of disorders, and they seem to intermingle. Now the bottom part of this spindle, you have the black down on the bottom, and it says coma down there, where basically if the central nervous system becomes less active, but there's also negative symptoms down at the bottom, and these are symptoms that basically are seen, noted by their absence. And this will become more apparent as we get going here. A lot of this you'll just have to read to try to make sense out of it. So here's, like I was talking about, the nuts and bolts of it. The psychomotor activity is basically reflected in this vertical axis on here, where it goes from seizure down to coma, and in the middle, of course, would be just a normal activity level. Anyway, the psychomotor activity level reflects the central nervous system arousal. Over in the middle part here, it says psychomotor activity, motor activity reflecting the CSN level, and this concentrates on this vertical up and down axis here, which is actually the grayscale of the color spindle, but I'm using it to indicate the CNS arousal level, and of course you'll have high, normal, and low, and you can see the states that go along with the seizure and excited down on through awake and stupor and sleep and coma. And in the middle, there's a band which would be people's normal level of psychomotor activity. So this is the rim of this color wheel with the color axis, the gray axis in the middle. Okay, here's concentrating on this psychomotor activity level again, these different states that reflect the level of arousal of the central nervous system. And in the middle of the slide here is a representation of what the activity that they would be in while they're awake and alert. The normal people activity level is on the average, neither hyper or hypo, but vary in between generally. And this in contrast to being abnormal. And if you look over on the extreme part of the page, there's a triangle there with the arousal level being on the left-hand side and going over towards the right-hand side of the lateral apex of this triangle, you would see normal and organized. So this basically is the dividing that triangle into positive and negative symptoms. In psychiatry, these positive symptoms are symptoms that have been added or in excess. They're present, but shouldn't be. And of course, one of the characteristic positive sign is hallucinations, and they shouldn't be there. And these signs of negative symptoms are basically subtracted, and they're deficient symptoms. In other words, this is like not expressing any emotion. In other words, affectless, they call it flat affect, but I just call it affectless. It's AFFECTLESS. And so these are symptoms that are behaviors and symptoms that would be considered normal if they were there, but in certain disorders like apathy, in depression or schizophrenia, they're not there. You should be able to feel things. Okay, and here's in the middle is a triangle just sort of expressing what the one up in the corner expresses. Down in the bottom of this page, there's 6 Ds and 5 Disses for judging abnormality. And this is just things that basically characterize abnormalities and a way to look at whether something is normal or abnormal. And here's just some representative pages out of this triangle that spindle, these triangular pages. And what they are is basically out on the lateral point of these triangles is what would be a normal personality trait that corresponds to the disorder that would be expressed out toward the gray area. I want to detour and make a segue into the rationale behind these triangular parts of the Spindle model. And this is what I'm going to talk about, is this Yerkes-Dodson curves, which is out of psychology. This is called Yerkes-Dodson law, and what it is it's an inverted curve that relates performance level to arousal level. So anyway, the example is that basically the student had test anxiety. So when he took his test, he didn't do as well as he should have because he had a high level of arousal. So anyway, the next test, he stays up and he studies all night so he'll know the subject matter so he won't have any test anxiety. Then he goes to take the test and he's so fatigued that basically he doesn't do well on the test either. And so what it is basically an inverted U curve that relates your arousal level to your performance level. And I'm using this to sort of justify the analogy between these color triangles and this Yerkes-Dodson law. But what you got to do is you got to rotate it, so that's what this curve shows. And so basically your arousal level is low and it's at the bottom, and the high arousal state is up at the top, just to make it more intuitive. And then this allows you to show the analogy between one of these triangular hue pages from the color spindle. And so the Yerkes-Dodson curve is on the left, and the color triangle page is on the right of it, so that you can see that they're nearly a mirror image of each other. I want to put a disclaimer on here. Presentations for information only, not intended to substitute for proper psychiatric care. Only I'm using of my ideas, doesn't represent anybody else's point of view. This next slide is a schematic of these color triangles, and it shows some about color mixing, which gets into the blends and things of the colors and the psychiatric disorders. They tend to blend in together. And so what we're going to use is that gray generalized page from the color spindle here that's got the white, blue, and dark blue and gray in it. But the other schemes are just to show you how the color mixing goes. Here's a little summary then. So we're going to go from this color spindle model, take a page out of that, let it be a representative page, and then basically generalize to this, what I call a generalized color page here. Then I'm mapping and superimposing these psychopathological concept dimensions onto this, basically two Venn diagrams that represent that color page triangle. And it talks about positive symptoms, which are added symptoms. They're abnormal symptoms that are added on, and basically the negative symptoms are subtracted deficit symptoms. In other words, these are behaviors that are normal that people lose in mental illness, such as attention, for instance. People have attention disruption in almost any psychiatric disorder. And so here's just reiteration of that. You can see down in the right lower corner there, those Venn diagrams on the prior page. And here's another, what it would look like with actually the color page. There's a lot of information in that. Anyway, this shows again the analogy between Yerkes-Dodson law and this representative color page.